All right, so this exercise here is called the sleeper stretch, or the stretch of posterior capsule of the shoulder. So you're gonna have the patient side lying, laying on their involved shoulder. So you're gonna have them apply an internal rotation force to stretch that posterior capsule. So you want to advise them to push into internal rotation until they feel a stretch in the back of their shoulder. You feel a stretch there.
Mm-hmm.
Good. So we're gonna apply that stretch for 30 to 60 seconds. Come out of it, and then we'll do 3 different sets of that. To regress this exercise, we're gonna have him roll off of his shoulder a little bit, so it's gonna open up a little bit more of that joint space. He's gonna apply that same internal rotation. As you can see, he's able to get more internal rotation here, because it is a little bit easier when you're rolled off of that shoulder. But if your patient has too much pain or is not able to get any internal range of motion in the first position, you can have them roll off and do it this way to progress this exercise. So I want you back on your shoulder. So we had them at 90 degrees of elevation, 90 degrees of elbow flexion. In the original exercise, we're going to decrease the amount of shoulder elevation, still keeping 90 degrees of elbow flexion, and have the patient apply that internal rotation force until they feel that stretch. So you can see he has even less internal rotation here. So it's making it a little bit harder, a little bit more of a posterior capsule stretch. So if he's getting a lot of internal rotation with the first exercise, you can progress into this and kind of challenge that posterior capsule just a little bit more.